Good morning, everyone. Welcome to the ophthalmology class. I hope I am audible and visible. Please let me know if my audio and video is good to go. So we will be starting today with the anatomy and development of the eye, and in these 3 days we will be going from A to Z of ophthalmology, the ride of ophthalmology. So are you ready, guys? Tell me about the audio and video ones. Am I audible and visible to everyone? So let's get started. Clear here. Okay, thank you, Aparna. And good morning, everyone. I am very happy to get you all. So let's get started and put the heading anatomy and development of the eye, and we will start with this great fellow, the Albert von Graffy. He is the father of modern ophthalmology. Modern means the technical ophthalmology. You know, we have so many instruments, so many tests in ophthalmology. So all these were given by this great fellow. Okay. So please write his name, father of modern ophthalmology or technical ophthalmology. So I will be drawing all the diagrams for you, and all the images that will be shown to you in the class will be given to you in the PDF form after the class. So don't worry about the images. As far as writing is concerned, I will be writing along with you, and we will be doing two things. You have to listen to me and you have to write along with me. So when I am writing, you can write, and when I am explaining, you can listen to me. And all the doubts are welcome on the group. Okay? No, notes will not be given to you in the PDF, only the images. Notes you have to write along with me, not the notes. Okay? And I'm telling you one thing, the notes that you make by your hand are actually the best notes. So it's always better that you write the notes by yourself. Okay? All right. Now see this. This is the structure of the orbit. See, when I talk about the ophthal, we are talking about the eyeball along with the orbit. So we are talking about two things. One is the eyeball and one is the orbit. So if you look here, this is the orbit here. One orbit here and one orbital cavity here. This is the structure. I will be drawing this diagram for you. Just I am first explaining. Is it buffering for everyone? Just a second. Let me check what has happened. Just a second, guys. I think it's good from our end. Those who are getting the buffering, please check once. Okay, the connection. Okay, so what I was saying, that we are having the two things, the eyeball and the orbit. So these are the orbits, and inside the orbit is this eyeball which is lying. You can see this eyeball. This is the shape of the eyeball. You can continue with your old notes, and you can add up. If you get anything, all the updates you can add up in your notes. Okay. Now see this. This is the eyeball which is present inside the orbital cavity. Okay. So it is something like this. The orbits are pyramidal and they contain the eyeball in the front. So apex is behind, base is anteriorly, and in the base we have this eyeball. Okay. Now if you look at these lateral walls, when you are joining them backwards, The angle is 90 degree. They are perpendicular. And look at the medial walls. These are the medial walls. Can you see? They are parallel. So when you see the angle between this medial wall and lateral wall, this is 45 degree and 45 degree. Okay. So the angle between the medial wall and the lateral wall is 45 here. Between medial and lateral is 45 here. Now when you see this orbital cavity from the front, have a look here. So all of you have seen the skull, you have seen the facial space in your anatomies. Now see here, whenever you look at the base of the orbit, they are roughly quadrangular. See, quadrangular I can say because we have got 4 walls. So we have this superior, we have got superior, then we have inferior, medial and lateral. So it is quadrangular, and inside this quadrangular orbit lies the eyeball, the beautifully depicted. See, 1, 2, 3, 4 walls, and inside this we have got the eyeball. So basically the structure of the orbit and the eyeball. Now when you concentrate on the shape of the eyeball, see this. When you focus on the shape of the eyeball, it is not a perfect sphere. It is having the extra curvature anteriorly like this. This is the extra curvature. Due to this extra curvature, it is called as ablate spheroid. It is not a perfect spheroid. It is a ablate spheroid. So if you look at the shape of the eyeball, it is spherical, but the extra curvature is present anteriorly at the place of cornea, so that we have maximum refraction here. That is why in optics you will study that this is the most important refractive surface also. This extra curvature, see it from side. So we have this extra curvature in the cornea. This extra curvature in the cornea give it a shape of ablate spheroid. Ablate spheroid. Okay. So on this basis, now we are going to write about the eyeball. Put the heading anatomy and the development of the eye. The anatomy and the development of the eye we are talking about. Okay. So first of all, we will write the definition of eye. So eyeball is roughly spherical in shape. It is roughly spherical. And what was the name? Called as ablate spheroid. This is called as ablate spheroid. And then we are having cystic in consistency. The consistency of the eyeball is cystic. So you must be knowing, guys, cyst is a fluid filled cavity. So eyeball is also having fluids. Therefore, it's a ablate spheroid. It is cystic in consistency. We are having the fluid there kept distended. Kept distended. This eyeball is distended by the IOP. Now, whenever we have fluid, it will exert a pressure. So, if a pressure is there in the eyeball, this is called as This is called as intraocular pressure. This is called as intraocular pressure. The normal range is 11 to 21 mm of the mercury inside it. Inside the eyeball, due to the fluids, we have a pressure, and this pressure is called as intraocular pressure. So, 3 things which are important here. Ablate spheroid, cystic consistency, and the normal IOP 11 to 21. Three important things: ablate spheroid shape, cystic inconsistency, and the intraocular pressure is 11 to 21 mm of mercury. Are you getting this? Now the diagram that I was showing you, there were the two orbits like this. So draw the two parallel lines and then the two slanting lines. Then the two slanting lines. See this. This is the structure of the eyeball. Okay. And this is the orbit. So I can say this is the orbit. What is the shape here? It is pyramidal. Shape is pyramidal. And what is the volume? 30 cc. The volume is 30 cc. Orbit is pyramidal. Volume is 30 cc. And look at the base. It is quadrangular. So guys, this is the orbit and we were saying the base of the orbit. The base of the orbit is actually the quadrangular. This is the base, you can see, and this is the apex of the orbit. Okay, and base is quadrangular. So you can see something like this, and it has got the four walls. It has got the four walls: superior, inferior. Then we have medial, and this is the lateral wall. Okay. So you can see it is quadrangular while this was pyramidal. And look at the angles here. Now if I extend these lateral walls and join them, this angle becomes 90 degree. Then this angle is 90, and therefore the angle between the medial and lateral is 45 degree and 45 degree. 45 degree and 45 degree. This is the basic structure, and inside the base lies the eyeball. Inside the base is lying the eyeball, ablate spheroid. This is the ablate spheroid shape. See, ablate spheroid shape with the extra curvature anteriorly. This is the ablate spheroid shape. Please draw comparatively larger diagrams, especially the boys. Boys make very small ones, and afterwards there is a lot of problem for labeling also. Okay, make big diagrams, and from this eyeball comes the optic nerve like this. This is the optic nerve. This is the optic nerve here. So draw the diagram, and if you have drawn, start giving me the thumbs up, so that I get to know that you have drawn it. So we can see the orbit, you can see its base, you can see it's quadrangular. These are the different MCQs. The optic nerve, this angle, then pyramidal, its volume. Start drawing the diagram, guys, and whoever has drawn it, keep on giving me a thumbs up. You can see the shape of the eyeball, shape of the orbit, the angles. Okay, everybody has drawn. Very good, very good. So what are the summaries for this? We can say the two medial walls are parallel to each other. So these are the different questions you can get from this. Medial walls are parallel, while the two lateral walls. Okay, leave some space there, Utkarsh, and after the class, draw a big one there. No problem, Utkarsh. Okay, lateral walls are perpendicular. Then they can ask you the thinnest wall. The thinnest wall, thinnest is the medial wall, while if they ask you the thickest, thickest is the lateral. Thinnest and the thickest, medial and the lateral. And most commonly to get fracture, who will tell this? Most commonly to get fracture, very, very important question. So which wall is most commonly to get fracture is the inferior wall. Inferior wall, also called as floor. And this fracture is called as the blowout fracture. This fracture is called as blowout fracture. And this is a very, very commonly asked question. It was asked in NEET 2018. Then as an image based question, it came in NEET 2019. And then recently in the FMG examination 2023 also as the image based question this came. Very, very important. It also came as a image based question in 2023. So very, very commonly asked. Blowout fracture. Blowout fracture is, yes, R. Vibha and Dr. All. So all of you have given the right answer. All these are very, very important questions regarding the orbit. Okay. Yes, teardrop side. Now talking about the coats or the layers. Coats or the layers of the eye. So there are 3 layers in the eyeball. 3 layers. We will be talking about them one by one. If I talk about the outer layer. Outer is the fibrous. Okay. Fibrous means strong. Outer or the fibrous coat. Fibrous is strong. So this consists of 2 parts. Now again see this eyeball. You can see this white part. White part is the sclera. And you can see this transparent portion is the cornea. So we have this anterior part cornea. And this posterior part is the sclera portion. And you can say that this is joined at a place. So this point at which it is joined is called as limbus. We have transparent cornea and we have got this one as sclera. and they are joined at the limbus. So whole of this is a fibrous coat. It consists of cornea and the sclera, and cornea is anterior 1/6. So if I divide whole of the eyeball into the 6 parts, anterior 1/6, anterior 1 part is cornea and remaining posterior 5/6 is actually the sclera. And as I told you, the junction is called as limbus. Junction is called as limbus. Now this limbus is important because we have so many things here. Limbus pe we give the incision in cataract. We also okay, so limbus pe we have limbal dermoid, we have got limbal follicles, Herbert follicles, we have Horner Trenta spots. So all these things are present at limbus. Then the second is the middle coat. Middle coat we will write with the red color, the vascular one, vascular or the middle coat, which consists of uveal tissue. Now you people also write it with the red color. Write it with the red color, the middle coat, because it is vascular, giving the blood supply. So we will try to create the visual memory. Every time you talk about the uveal tissue, you will remember that this is middle coat, red in color, so supplying the blood. And this uveal tissue consists of 3 things. It consists of iris. Then we have the ciliary body. Iris, ciliary body and the choroid. Iris, ciliary body and the choroid. So there are 3 parts in the middle coat. 3 parts in the middle coat. And finally the third is the inner. Inner is the nervous coat. Now this nervous is not anxiety, guys. It is the neural function. So which is responsible for doing the neural functions. So where do you have the image formation and who is taking the impulse? That is your nervous coat. So write it with blue color, electric blue. Electric blue color. This is the retina and the optic nerve. Retina and the optic nerve. Okay. So 3 colors of our flag and 3 colors of the eyeball. Each color represents a different thing. Okay. How many layers in retina? You people have to answer this question. How many layers? Then we will draw the diagram of eyeball. Utkarsh and everyone, this time you have to draw a large one. At least half of the page you have to draw this diagram of the eyeball. And see how you have to draw. First, you will draw a circle like this, okay? And then draw the anterior convexity, okay? Now what you have to do? Rub the inner. So this will give you the ablate. Yes, everybody is right. It is having the 10 layers. See this. Then you can rub the inner area. This will give you ablate spheroid shape. Ablate spheroid shape. So this will form the sclera and this will form cornea. Okay, this is forming cornea, while the junction is called as limbus. This is the outermost coat. You can see outermost coat. Draw it very, very carefully, and with the red color we will draw the middle coat. This is the iris here and this is the iris here. Then draw the ciliary body and extended posteriorly choroid. Extended posteriorly. This is choroid. So I will say this is the choroid. Okay. And this is the iris here. Iris. And this is the ciliary body. Draw this ciliary body. And then we will draw. You people have rightly said that retina has 10 colors. So from the junction of the ciliary body and choroid, we will draw a thick one because it has got the 10 layers. Okay? but only one layer of the retina will make the optic nerve. So I will make thin now and I will continue to form this optic nerve, and the outer portion of the optic nerve is myelinated. So yellow means myelination. This is the optic nerve. And this is retina. Retina has 10 layers. Optic nerve has 1 layer. And this is the lens here. Lens. This is the lens here. Okay. So this is how you have to draw it. We are having the sclera, choroid, retina, cornea, limbus, iris, ciliary body. Okay, this is the outer coat. You can see the optic nerve, and this cavity is called as vitreous. This cavity is called as vitreous cavity. Okay. Now, if I want to see the internal structure, for the internal structure, I will divide the eyeball into 2 parts, and listen to me, this is an imaginary line. By a imaginary line, and before that we can join the lens by the zonules. These are zonules which are holding the lens. Okay. Now draw a imaginary line which is passing through the lens. So I am telling you so many times that this is imaginary line. So if I draw imaginary line passing through the lens, I can divide the eyeball into the 2 segments like this. So one anteriorly will be the anterior segment and posteriorly is the posterior segment. Anterior segment, posterior segment. Anterior segment is anterior to the lens, posterior segment, posterior to the lens. Now, what is the fluid of anterior segment, guys? What is the fluid of anterior segment? Anybody? What is the fluid of anterior segment? It is aqueous humor, and aqua means water. So see, now I will be drawing the aqua blue color here. Everywhere, wherever I am using this color, this will be your, yes, aqueous humor. So wherever I am using this aqua blue color, that means I am drawing the aqueous humor. You can use the highlighters to have the same color. Green, yellow and blue, 3 highlighters you should have at least, and 1 orange for the retina also. Okay. So these are the aqueous blue color. While posteriorly we have vitreous, and vitreous is gel-like. So you will have bundles there. Collagen bundles, we have something like this. And the zonules are also the part of the vitreous. That is why zonules are also part of the vitreous. That is why we are coloring this also as green. So now I can say that this is the aqueous humor here, and this is a vitreous humor. Aqueous humor, vitreous humor. And one more thing now, can you see anterior segment is up to the lens, that is divided into 2 parts by this iris. So one is anterior to the iris and one is this posterior to the iris. So this is anterior chamber and posterior chamber. Means anterior segment can be divided into anterior chamber, posterior chamber. And anterior chamber is 2 to 3 mm deep. The depth of anterior chamber is 2 to 3 mm. This is the total complete beautiful diagram of the eyeball having the 2 segments, 2 chambers. And both the chambers are in anterior, so both will contain aqueous humor only. Depth of anterior chamber is 2 to 3 mm. It is again important. We do not measure the depth of posterior chamber, not required. Anterior chamber depth is actually required for glaucoma. That is why we are taking. So the 2 fluids, then the 2 segments, the 2 chambers, the 3 eyeball layers along with the shape of the eyeball. Very, very important. Please draw it, and As you draw it, start giving me a thumbs up. Draw this as a big, this is the basic thing actually you need to know whenever we will be learning about the pathologies in the eyeball. What will be important that you should know. If I am saying blood in anterior chamber, pus in anterior chamber, where is anterior chamber, where is posterior chamber, where we have posterior segment, what are the different parts. So all this will be important there. So please see a very, very beautiful diagram of the eyeball. Everybody is clear. So if you look here, if you look at the segments, we were having the anterior and the posterior segment. So I can say anterior will be the structures anterior to the lens. Structures anterior to the lens, including the lens. Including the lens. The structures which are they are anterior to the lens. So when I am talking about cornea, iris, ciliary body, all these are anterior segment, while the structures which are posterior to the lens, structure posterior to the lens, that all will form the posterior segment. Structures anterior to the lens, structures posterior to the lens. Now this anterior segment contains the aqueous humor. Oh, don't draw it like this. Who has drawn this reality? I don't want this one. Eye is, ophthalmology is one topic that it should be colorful, because eyes is one organ that makes your life colorful. So don't sit for your notes without your color pens. After the class, I will share these hand-drawn diagrams over the group, and please complete it. Hannah, tomorrow share me the good ones. Aqueous humor, which is watery in consistency. Vitreous humor here. Vitreous humor here we have. And this is gel-like. Okay? This is gel-like. Now, second important thing, aqueous humor has a continuous formation. Somebody who has drawn the color diagram also share the image, continuous formation. After the class, definitely you have to share the good diagram to me. Nobody will make such kind of diagrams only with the pens, okay? Continuous formation, aqueous humor continues to form, vitreous humor is fixed. It is fixed, that is 4 ml. It will not form throughout the life. Better. And try to use the non-ruled pages for your notes. Good one. Vitreous cavity ऐसा lines नहीं है, bundles. Optic nerve yellow, keep your highlighters. Vitreous humor pink, green, guys, green. Color, follow the color also. Yes, this one girls diagram is good. So I can expect this from girls. Boys also, please do it very, very carefully. Boys, back up. Much better, very good. This one is very good. Highlighter se बनाओगे तो very good. See how much efforts you are putting in your notes will pay off. So if you are making them passionately, your scores will also be passionate towards you. Okay? Chalo. Then aqueous humor. Aqueous humor can be divided into 2 parts. We have anterior chamber, posterior chamber. So how much in anterior chamber? It is 0.25 ml. Posterior chamber mein 0.06. 0.06 ml. Beautiful. Oh. Who has drawn this beautiful one? It's very, very good. So one heart to this diagram. Very, very good. और ये पिंक किसने बनाया? एक्वस ह्यूमर पिंक. डोंट ड्रॉ एक्वस ह्यूमर पिंक. चलो. Now we come to aqueous humor in anterior chamber, posterior chamber and vitreous humor. Now if you look at the vitreous humor, we have 3 kinds of vitreous humor. vitreous humor, primary, secondary and tertiary. We have three kind of vitreous humor. You have written my initials instead of vitreous humor. N लिखा हुआ है 6 times N in the vitreous cavity. And this vitreous cavity is empty without the vitreous humor. ठीक है, now stop sharing. Otherwise people won't focus. So vitreous humor is of three types. Primary vitreous is in the intrauterine life. That is before the birth. Before the birth, we have primary vitreous in the intrauterine life. Secondary and tertiary after the birth. After the birth, we have secondary and tertiary. Now, first we see the structure of this primary vitreous. The structure of the primary vitreous we will draw. So see this is the cornea here, and draw then iris something like this. Then draw the ciliary body just by like this. Then we will draw the lens biconvex and make the vitreous cavity. This is a simple diagram, just 4 lines and you will complete. And here we will draw the optic nerve. Okay, try to follow the color patterns that I am giving you because they are as close to the normal as possible. Aqueous humor is watery, vitreous humor is collagen, that is why green. Optic nerve is myelinated nerve, therefore yellow. Okay, so please choose the colors wisely. So in the intrauterine period, we have a canal here. We have a canal in the vitreous cavity like this. This canal is called as canal of Clockway. The T is silent here, canal of Clockway, and this space. So I have to write, that is why I am rubbing this. Okay. Now see this space is called as space of Berger. This space is called as the space of Berger. Space of Berger. And inside this canal runs a artery. Guys, draw this. I'm just coming back. Okay, draw this. Right? So inside this canal, we have a artery, and this artery will be called as the hyaloid artery. Now what you have to remember, that anything which is related to the vitreous is called as hyaloid. This is hyaloid, and this is the optic nerve. This is the optic nerve here. And then we have the vitreous. Now, because this vitreous is present in the intrauterine life, therefore this will be the primary vitreous. And we will draw the hyaloid artery branches to the vitreous. See this. So basically, the hyaloid artery is supplying this vitreous. Because it is supplying, so this is vascular. Now you will tell me that if it is vascular, from which germ layer it should develop? Which germ layer? Answer this question. And then these are your collagen bundles. Vitreous is made up of collagen bundles. And inside this collagen bundles, we have got the crystals. These crystals are the crystals of hyaluronic acid. Another important question. All the PYQs till 2017, I will be telling you in the class. All PYQs. So actually all PYQs which are required for your exam will be discussed in the class itself. After the class, I will give you a PDF of all the PYQs at one place with the highlighted answers also. ठीक है ना? So these are your hyaluronic acid crystals. These are hyaluronic acid. So there are so many PYQs from this area. They can actually ask you the space of Berger, name of the canal, name of the artery, collagen, crystals, and from which germ layer it should develop. Nobody has answered that question. I said that primary vitreous is a vascular thing. So from which germ layer should actually it should develop? It should develop from which germ layer? Mesoderm, because it is vascular. So you will see even the development of the different parts of the vitreous is taking place from different germ layers, because the primary vitreous which is present in the intrauterine life has a mesodermal origin because it has a blood supply. It is vascular. Achha, now I am getting the answers. Yes, very good. It is the mesoderm because it has the blood supply. And another thing is that if they ask you what are which fluid contains the hyaluronic acid, so always remember it is the vitreous humor. Though hyaluronic acid is also present in synovial fluid, but still if the question is asked and both the fluids are in the option, then also you have to choose the vitreous humor itself. So everything related to vitreous is hyaluronic, hyaloid artery, hyaluronic acid, and therefore the membranes that it is forming. The membrane that it is forming is also hyaloid membrane. So one membrane is anteriorly, it is condensing because vitreous is gel-like. So it is condensing to form a membrane anteriorly as well as posteriorly also, like this. Okay? Anteriorly as well as posteriorly. Yes, all of you are right and given the right answer. So you can see here, anteriorly we have this anterior hyaloid membrane. Anterior hyaloid. So hyaluronic acid, then hyaloid artery, hyaloid membrane. Anteriorly, anterior hyaloid artery, anterior hyaloid membrane. And posteriorly is the posterior hyaloid. Posteriorly is the posterior hyaloid membrane. That is why I always ask you to draw the big diagram. See, when space is very, very less for you to do the labeling. So I have two membranes, anterior hyaloid, posterior hyaloid. Now what happens? Anterior is connected by a ligament here. Here it is connected with the help of this ligament. It is densely attached. So anterior is densely attached to the lens. Anterior hyaloid membrane is densely attached to the lens by a ligament. What is the name of the ligament? Weigert ligament. By the Weigert ligament. It is densely attached by a ligament called as Weigert ligament or hyaloido. See it carefully. Very important name. See this. I will show you the full diagram also. First write the name of this ligament, hyaloido. Capsular. Hyaloido. Capsular ligament. So name of the ligament is hyaloido and capsular, or it is also called as Weigert's ligament. So what are the attachment, guys? Hyaloido means anterior hyaloid membrane. Capsular means it is the posterior capsule. Posterior capsule of the lens. anterior hyaloid membrane and the posterior capsule of the lens. So it is this anterior one which is densely attached with the help of a ligament. This is also a PYQ, the attachments. PYQ. Now you can see the full one. This is the anterior hyaloid membrane connected with the help of a ligament called as Wigert's ligament. The other name is hyaloidoencapsular. So if they are asking you attachment, just remember the name hyaloidoencapsular. On the other hand, if you look at this posterior hyaloid membrane, I have drawn this dotted because it is loosely attached. It is loosely attached to the retina. It is loosely attached to the retina. Please draw the diagram. Meanwhile, I am sharing the questions related to this. Please complete the diagram and start giving me the thumbs up so that I get to know that you have drawn it. Meanwhile, I am sharing you certain things. Just a second. You have drawn it. Okay. Now see, because this is loosely attached to the retina, it can lead to the PVD. It can actually lead to the PVD. PVD means posterior vitreous detachment. Because it is loosely attached to the retina, so it can lead to PVD, posterior vitreous detachment, due to the aging. So as the aging will take place, slowly and gradually it will detach from the retina. There was a question also related to this. Let me share that question. And see the question number 381. All these questions that I share are your PYQs, then your hand diagram, then this second one. Yes, so you can answer the question here also. You can answer the question number 381. This is the quiz number 381 here. Quiz number 381. So this is about the primary vitreous. Primary vitreous was vascular. Now what happens at about 3 to 4 months? 3 to 4 months of the intrauterine life. 3 to 4 months of the intrauterine life, there is a regression. There is a regression of the hyaloid artery, and hyaloid artery was supplying the primary vitreous. Therefore, plus the primary vitreous also. So there starts the regression of the hyaloid artery. Always answer as a reply over the question, otherwise I won't come to know Pravalika and other people, Gayatri, Deepti, Pranati, Vibha. Okay, then I will not come to know that which question you are answering. And therefore they are starting getting replacement by the secondary vitreous. They will be getting replacement by the secondary vitreous. So at 3 to 4 months of the intrauterine life, artery starts regressing. Artery will not supply the primary vitreous. Primary vitreous starts regressing, and they start getting replacement by secondary vitreous at the time of the birth. Therefore, we do not have primary vitreous. We will just have secondary vitreous. Okay. And therefore, this will be developing from neuroectoderm. This is not having any blood supply. So, not coming from the mesoderm. Now, this is coming from neuroectoderm. And also, Also, secondary vitreous is doing one more thing. Secondary vitreous forms the ciliary zonules. It is also forming the ciliary zonules, which is called as tertiary vitreous. So tertiary vitreous is nothing but the vitreous which is forming from the secondary vitreous itself. It is also called as the ciliary zonules. And because it is coming from secondary vitreous, so this is also developing from neuroectoderm. Secondary and tertiary vitreous are developing from neuroectoderm, while primary from the mesoderm. This is the summary of primary vitreous, secondary vitreous, and tertiary vitreous. Primary, secondary, and tertiary vitreous. Have you understood? Have you written, everyone? Everybody has written? We will be moving towards the dimensions of the eye. Another important thing is the dimensions of eye. So how many diameters are we expecting in eye? How many diameters we are expecting in eye? It is 3 diameters. 3 diameters. See, if this is the orbit here and this is the eyeball. So we are having the 3 diameters. One will be this one. This is the antero-posterior diameter. Should I go a bit slow as you want? You people are post intern, that is why I was maintaining a good speed. Otherwise, you people start feeling bored. So if you want, I can be a bit slow. What is the suggestion of other people? Whatever is for the majority, I will go with the majority. Humaira, whatever you are not able to write, tell me. This would be fine. Chalo. Now see the dimensions of the eye. So this is antero-posterior. Antero-posterior. Thank you for the feedback, guys. Thank you. This is antero-posterior. And if you see it from the front, now it is like this. So one is this antero-posterior diameter because orbits are antero-posterior. And then you can see here, one is this vertical and another is this horizontal. See, some people are saying to even increase. कोई बात नहीं Humaira, try to patch up and anything is left, please tell me. ये देखो, we have vertical, चलो, and this is horizontal. And third is this antero-posterior. So out of the 3, now, when is the tertiary vitreous formed? At the time of birth itself, we have 2, secondary and tertiary. Before birth, primary, secondary, tertiary at birth. ठीक है आशीष? At the birth itself. Ciliary zonules are formed from secondary vitreous. Therefore, both are coming from neuroectoderm. Replacement by the secondary vitreous takes place at the time of birth itself. So at the time of birth, the secondary vitreous forms the tertiary vitreous or the ciliary zonules. So both will be coming from neuroectoderm. Both are coming from neuroectoderm. अभी ठीक है? So all the structures we did in the primary vitreous will disappear at birth. Yes, normally they will disappear. Normally they will disappear. Yes, Utkarsh. ठीक है? चलो, अब dimensions की बात करते हैं. Diameters were antero-posterior, then it was horizontal and also vertical. Now you can see that this diameter will be the largest because it is in the orbital cavity. Now, if you compare between horizontal and vertical, so our eyes are horizontally set. Have you started from here now? Dimensions of the eye देखोगे. Dimensions of the eye में We have orbits. Orbits में we have got the eyeball. So orbits are lying anteroposteriorly like this. Therefore, this is the largest diameter. Then we have got the eyeballs. Eyeballs are horizontally set. So horizontal is more than vertical. Horizontal is more than vertical. So you can simply remember the mnemonic VA. And what is the year going on? 23. So remember the mnemonic VA 23. Remember the mnemonic VA 23. So we have V for vertical, H for horizontal and A for anteroposterior. V for vertical, H for horizontal and A for anteroposterior. Okay? Now we will start from V. V is the vertical diameter. We are starting from the smallest one because I said that there are 3 diameters and anteroposterior is the largest. Then eyes are horizontally set. So horizontal is more than vertical. Therefore, vertical will be the smallest one. Smallest is the vertical. Then H. H is the horizontal. Next is the horizontal. And then next is A. A is the anteroposterior. A is anteroposterior. V for vertical, H for horizontal, A for anteroposterior. ठीक है? DO and Humera. So we have vertical. Try to catch up from here now. Vertical, horizontal and anteroposterior. So this will be the largest here. No MK. Don't derive it like this. All the structures are not coming from zonules. We are talking only about the vitreous, which are of 3 types. All the structures are not coming from this. Only the vitreous coming from this. Now we were also having 23. So what is the diameter? Start from 23. Then add 0.5 and you get 23.5. Then again add 0.5. And you get 24. So just remember VA 23 and you can remember all the diameters of the eye. We have 23, 23.5 and 24 with smallest as well as largest. 5 MCQs you can see. 5 MCQs something like this. Okay. Now if they ask you the volume of the eyeball, then weight of the eyeball and the circumference. Also the circumference, volume, weight and circumference. So here you remember 23. Similarly, here we will remember 6.5. Here remember 6.5. Add 0.5, you get 7. Then add again 0.5 and you get 7.5. And you get 7.5. So in this way you can get all the 3 dimensions, 3 diameters, 23, 23.5 and 24, while the volume, weight and circumference. Now here the unit was same. All this was in mm. Okay. But here the unit will be different because it is volume, weight and circumference. So volume will be in ml. Now obviously it cannot be 6.5 liters. Yes. So it will be in ml. So one thing is common sense. That is very, very important. And what happens, more we read, less are we associated with common sense. We have that fear factor. If we have read, only then I can answer. If we have read this, if it is in the notes, then only I can answer. See, if it is volume, it has to be in ml. It cannot be 6.5 liters inside the eye. Then weight will be in grams. It cannot be kgs. And circumference will be in centimeter, not the meter and kilometer. So 8 MCQs you can solve from this information directly. And for database questions, you require certain correlation. So you can see easily that these are the dimensions which are there in the eye. We have the 3 diameters along with the volume, weight and circumference. Written everyone now? So these are actually the adult diameters. These are adult diameters. At the time of the birth, eyeball will be different. It will be smaller. Do you know the normal visual acuity, guys? If I talk about normal visual acuity, it is 6 by 6. 6 by 6 is normal. And at birth, at the time of birth, we do not have 6 by 6. We do not have 6 by 6. That is why we can say that the eyeball is smaller at the time of birth. Baby is having small eyeball and that will slowly and gradually grow. Now, if I am having small eyeball, what will happen? Small eye will have less power. And if it is having less power, the rays will go more posteriorly to get focus. Therefore, there will be hypermetropia. Therefore, every eye will have hypermetropia at the time of birth. So, this is to explain you that the eye is not same at the time of birth. Its visual acuity is also different. It has less power, which is going towards hypermetropia. It is having the less power. So, if I write the eye at the time of birth, if I say eye at the time of birth, at the time of the birth, number 1, it is smaller in size. Smaller in size, that is about 16.5 mm. This is the axial length. The axial length is 16.5 mm and this 16.5 mm is 70%. 70% of the adult size. At the time of birth, it is 70% of the adult size. Okay. Number 2. If the size is small, therefore I told you the refractive status is hypermetropia. Hypermetropia, it is about +2 to +3 diopters. The hypermetropia which is present at the time of birth is +2 to +3. And finally, it will get the emetropia. It will get emetropia by the age of 5 to 7 years. Emetropia by the age of 5 to 7 years. So slowly and gradually, hypermetropia is acting as a stimulus basically. It is acting as a stimulus for the growth of the eyeball. Grow and become emetropic. So therefore, I can say that hypermetropia is actually good for the eye because it was smaller. So this is actually stimulating the eyeball to grow and become emetropic by the age of 5 to 7 years. Okay. So this is the growth part. If I talk about the development. So development of the reflexes. Development of the reflexes, we have got, one is the fixation reflex. Fixation reflex. Number 2 will be the macular differentiation. Number 2 is the macular differentiation. And number 3 will be the stereopsis. Number 3 is the stereopsis. Stereopsis means the depth perception. Depth perception or the 3D perception. Depth perception or 3D perception. So one is the fixation reflex, which is coming between 2 to 4 months. Macular differentiation comes between 4 to 6 months. And third is your stereopsis. That will take maximum time. First to develop is this fixation reflex. Second is the macular differentiation. And third is the stereopsis. Now this will take maximum time. This is the 3D vision. 3D vision or the depth perception. It will actually start. It will start at 6 to 8 months. But if I talk about the completion, completes by the 5 to 7 years. It completes by 5 to 7 years. This is the depth perception or the stereopsis. So it is starting with the fixation reflex. Next is the macular differentiation. Next is stereopsis. Stereopsis means the 3D vision. I think that is the most important part and the most beautiful part of your vision, because we always enjoy more of 3D vision. You look, if you have an option of viewing a movie in a 3D, or if you look at the children whenever they are playing the video games, they are always more interested when you have the 3D vision. So this is the stereopsis. Now, if you look at this, the macular differentiation, what is actually macula? Macula is the central retina, okay? Macula is the central part of the retina, and central retina is having cones, okay? And cones are responsible for the color vision. Cones are responsible for color vision. So macula is actually the central part of the retina, and central part of the retina have cones. Cones are responsible for color vision. And you can remember this by C. C for central retina, C for cones, and C for color vision. Okay. Now see, this macular differentiation comes at 4 to 6 months. Now this is a very interesting fact. See, we always take so many colorful gifts for our babies, but actually babies are color blind and they are not able to differentiate the different colors. It is only at 4 to 6 months that their color differentiation will come. So this is not the first thing that actually develops. This is not the first thing. Now the second thing. What is the first thing then that develops? The first is this fixation reflex, right? Now look here. So what happened? All of you started looking here. You are fixing on this object because you people have that fixation reflex. So it is the ability to fix at a particular object that is called as a fixation reflex. This is a remote. We can use something else. Anything you can use to fix, like I can use this, fix here. So I can look at here. I can have that fixation reflex. But what happens in the case of babies, they have a wandering vision. They keep on looking here and there. They are not able to fix. Why? Because their fixation reflex develops between 2 to 4 months. So first the baby learns to fix. Then second is the color differentiation. And third is the stereopsis. And then third is the stereopsis. Are you getting this? So once a baby has this fixation reflex, then there is a color differentiation in the baby, and finally is the stereopsis. And if you look at the stereopsis, the full completion is at 5 to 7 years. Now what else was taking place at 5 to 7 years? If you look here, at 5 to 7 years, we have this emetropia also. So we also have 5 to 7 years pe emetropia, right? So visually we can say that the total maturation is actually taking place by the age of 5 to 7 years. That is why actually the minimum age for a nursery class that is kept is at 5 years. This is the 5 years is kept as the minimum age for a nursery class. Nursery class के लिए, nursery infant or the infant class के लिए, the minimum age criteria that is kept as 5 years, because when a child is sitting in a class as a student, what are our minimum expectations? Child should be able to see the board. Child should be able to see the teacher, child should be able to see his notebook, then also his neighbor's notebook. So all these things comes minimum by 5 years. That is the minimum age criteria for taking the admission in the nursery class. Ma'am, the first month baby not able to fix. Yes. So baby is not able to fix. He is able to fix anytime between 2 to 4 months. First month kya? Maybe baby is not able to fix even at 2 months. Fixation can come at 2 months, 3 months, 4 months, anytime. So please see if you have understood and written this. This is the story for the development of the eye. Story for the development, growth and development of the eye. Have you written, understood? Then we will be moving towards the embryology. Have you written, everyone? Any questions from this? Next we will come towards the embryology. So I hope you people are able to write. It's audible, legible, visible, clear, everything going fine. Speed is fine. Coming towards the embryology, the gene which is responsible for the development is the PAX6 gene. And it is it starts at 3rd week, period of gestation. 3rd week, and it completes by 9 to 10 weeks, period of gestation. POG means the period of gestation. Period of gestation. PAX6 gene starting at 3rd week. So at 3rd week, we have the starting of the development, and by 9 to 10 weeks, the development is completing. It is taking place from 4 structures. From the 4 structures. The development of the eye takes place from the 4 structures. One is the lens vesicle. Lens vesicle represents the surface ectoderm. Representing the surface ectoderm. Then number 2 is the optic vesicle. Optic vesicle represents the neuroectoderm. Neuroectoderm. Then number 3 is the mesoderm. And number 4 is the visceral mesenchyme. Visceral mesenchyme, and this mesenchyme is coming from neural crest. It is coming from the neural crest. So we have surface ectoderm, neuroectoderm, mesoderm and neural crest. Surface ectoderm. So it is coming from ectoderm, mesoderm and neural crest, not from the endoderm. Another important thing, all the structures of the eye, I think it's stuck. Just a second. You're right, I am talking for the camera. These are the 4 structures from which the development of the eye takes place, and no structure is developing from the endoderm. No structure is actually taking place from the endoderm. Now it's okay. Now coming from the individual derivatives, number one is the surface ectoderm. So what are the derivatives of surface ectoderm? There is a mnemonic: lens epithelial cells. The mnemonic is the lens epithelial cells, and total will be L3EC square. This is the mnemonic, L3EC square. So one is the lens itself. One is the lens that is developing from surface ectoderm. Then next is epithelium. Epithelium of just a second, guys. Again, I think it has stuck. You write epithelium of the cornea and the conjunctiva. कर दिया. So we have lens, then epithelium, epithelium of the cornea and the conjunctiva, cornea and the conjunctiva, and then we have lids also. Okay, and finally is the lacrimal apparatus. Lacrimal apparatus. So L for lids, L for lids, and L for lacrimal apparatus, while epithelium of cornea as well as conjunctiva. Epithelium of the cornea and conjunctiva. This is the surface ectoderm. L3. So this is L1. Then we have L2 and then we have L3. Then C1 and C2. So this is your lens epithelial cells. Lens epithelial cells, guys, written. Please see. Moving towards the second one. Second is the neuroectoderm. Now the neuroectoderm. Neuro means nervous coat. So nervous coat mein now we have the retina and the optic nerve. Retina and the optic nerve. Then we have the epithelium. Now guys, we have already done with the epithelium of lens, lids, lacrimal apparatus. We have done with the epithelium of cornea, conjunctiva, retina and optic nerve. So what is left? You are left with the iris and the ciliary body. So we are left with the iris and the ciliary body along with the secondary and tertiary vitreous. Secondary and tertiary vitreous. We have already read about secondary and tertiary vitreous, and now the most important thing here will be the smooth muscles. Smooth muscles of the iris. Now who will tell me the names of the smooth muscles of the iris? Tell me the names of the smooth muscles of the iris along with their action. Neuro, you can remember neuros and nervous cord. Then the epithelium, which is remaining. Secondary and tertiary vitreous we have already done in the neuroectoderm. And now coming with the smooth muscles of the iris. So what are the names of smooth muscles of the iris? Names for the smooth muscles of the iris, anyone? What are the names for the smooth muscles of the iris and what are their function? Functions of the smooth muscles of the iris, sphincter pupillae and dilator pupillae. Very good, Arushi. And what are they doing? Constriction and dilatation. So neurological function. Yes, very good, Sameer. So basically, they are doing the neurological function of constriction and dilator pupillae. Sphincter pupillae, dilator pupillae, and because they are doing the neurological function, just a second. Therefore, because they are doing the neurological function, therefore their action will be the because their action is neurological, therefore they are coming from neuroectoderm. So always remember that the structure and the function both goes hand in hand. Those muscles which are responsible for motility, those muscles which are responsible for motility will come from the mesoderm, but those muscles which are responsible for the constriction and dilatation of the pupil, they have a neurological function, therefore they will come from neuroectoderm. Okay? Now coming from the third one, this is the mesoderm. Now I have already talked about the primary vitreous. Primary vitreous was vascular and that is why it was coming from the mesoderm. Now what else? Very, very important are the extraocular muscles. Another important thing is the extraocular muscles. What is happening? So we have extraocular muscles. Extraocular muscles are responsible for the motility. Now, how many extraocular muscles we have? It is the 7 pair. It is the 7 pair. So, we have LPS muscle along with the 4 recti along with the 2 obliques. Okay. We have got the 7 pair. So, all these 7 pair of the extraocular muscles all these extraocular muscles will come from mesoderm. Then we also have the choriocapillaries. Choriocapillaries along with the temporal sclera. Only the temporal part of the sclera is actually coming from mesoderm along with the vascular endothelium. Vascular endothelium of the eye and the orbit. Vascular endothelium of the eye and the orbit. 7 pair of the extraocular muscles, choriocapillaries, temporal sclera, temporal sclera along with the vascular endothelium. Now, if you look at this mesoderm, there are 3 things which are important. One is the choroid, one is the sclera, and one is the endothelium. There are 3 things which are important here. One is the choroid, one is the sclera, and one is the endothelium. And these 3 words will come from neural crest also. So I will tell you when you have to decide that answer is neural crest or the mesoderm. Please highlight these 3 things. It is the choroid, sclera, and the endothelium. Choroid, sclera, and the endothelium. And then finally the number 4, that is the neural crest. The neural crest here. Neural crest has got 2 parts, guys. We have mesenchymal and then we have the neural. Mesenchymal part and the neural part. Now, neural part will give rise to only 2 things. One is the Schwann cells and another is the melanocytes. Schwann cells and melanocytes. It is the Schwann cells and the melanocytes. While mesenchymal part में choriocapillaries made the hyaloid artery. Yes, so all the blood vessels will come from there. Now we come to the mesenchymal part. Mesenchymal part is responsible for the orbit. Orbit is the bony part of the eye. Then we have the trabecular meshwork. We have the trabecular meshwork. Trabecular meshwork is actually that part of the eye which is responsible for the drainage of the aqueous humor, which is drainage for the aqueous humor. Neural crest is having 2 parts. एक मिनट, पता नहीं क्या प्रॉब्लम आ रही है. The neural crest is having 2 parts. One is the mesenchymal part and one is the neural part. Okay. Now the neural part is responsible for two cells. One is the Schwann cells and the melanocytes. Schwann cells are responsible for the myelination of the peripheral nervous system, and then second is the melanocytes. While if you look at the mesenchymal part of the neural crest, the mesenchymal part of the neural crest is responsible. One is the orbital tissue. Then we have got the second trabecular meshwork. Okay, I am repeating this part. Trabecular meshwork is one which is responsible for the drainage of aqueous humor. And then third we have got the stroma. Now if you look at the stroma, we have the stroma of the cornea. Then even if I am stuck, guys, you are able to see the screen and hear me. Okay, concentrate there. We are looking into it. Cornea, sclera. Then we have iris, ciliary body and the choroid. The stroma of the cornea, sclera, iris, ciliary body and choroid. So if you see, sclera may all except the temporal. All except the temporal sclera. Because the temporal was coming from mesoderm and also the stroma of the choroid. Also the stroma of the choroid along with the corneal endothelium. Now see the three words that I was saying. The three words that I was saying, that they are also there in the mesoderm as well as the neural crest. We have sclera, we have choroid and we have endothelium. Sclera, choroid and endothelium. Now if they say sclera, totally sclera, then the answer is neural crest. But if they say temporal sclera, then your answer will be mesoderm. Similarly, choroid. Now choroid may, if they say choriocapillaries, the answer is mesoderm. If they say choroidal stroma, then the answer is neural crest. If they say only endothelium, it is the mesoderm. If they say corneal endothelium, then the answer will be the neural crest. So please see, guys, anything that you want me to repeat, I will repeat. This is the development portion of the eye, the embryology portion. So total eye we have done. Total eye, its parts, its structures along with the embryology portion. I think this link is creating some problem, so we'll stop here and we will start with a newer link. Till the time, please go through the notes. Please see anything that you want the repetition or you are not clear with, and we will repeat that part. Yes, Mrilalini, which part you want me to repeat? I will repeat this, I think, after the break with the new link, because this is creating. Achha, sclera, choroid and endothelium. Sclera, choroid and endothelium means if I am talking only of the sclera, see this, only sclera is your neural crest, while temporal will come from mesoderm. Similarly, choroid mein, stroma of the choroid will come from neural crest, and the choroidal capillaries will come from mesoderm. And endothelium, the corneal endothelium is coming from neural crest, while the only endothelium, vascular endothelium, will come from mesoderm. So here we take a short break, and after the break with the new link, I'll be joining you. Thank you, guys.